Everything this administration has done has accrued to the wealthy, the very wealthy, the super wealthy, and has been done so at the need of those who are most in need. This government is supposed to work for the people, not against the people. And this president has shown us what a president looks like, acts like, speaks like, and does when he doesn't give a shit about this country. I yield back.
A first-term congressman walked into a budget hearing and turned the entire healthcare debate upside down using nothing but facts, receipts, and a 2-year-old's logic. Stick around to the end, because what he said about who actually broke the system will change how you think about your insurance bill forever. And if you think this is just another political back and forth, you have not seen anything yet.
You want affordable health care insurance and you want the system to be easy to handle, then recognize that government should do its job on behalf of the people of this country. And we should have universal health care known as Medicare for all, and then we wouldn't have this problem. Mr. Roy, let me ask you a question. Are you not insured because you're so wealthy that you don't need to be insured?
Oh, I'm so appreciative of this question, ma'am, because the reason I'm not insured at the moment is because I'm in between jobs in terms of W-2. And I actually am on the board of a company called Crowd Health that provides an alternative to health insurance that is far less expensive than what I would be able to buy on the Affordable Care Act's insurance marketplaces,
So then,
which
all
I
right,
find,
fine, I got the
so I
answer to
saved
your
money by actually not being
you have
insured.
access to health care.
We all have access
And
to
at
health
the end of the day, everything this administration has done has accrued to the wealthy, the very wealthy, the super wealthy, and has been done so at the need of those who are most in need. This government is supposed to work for the people, not against the people. And this president has shown us what a president looks like, acts like, speaks like, and does when he doesn't give a shit about this country. I yield back.
Thank you. The chair now recognizes the birthday boy from North Carolina, Mr. McDowell.
Thank you, Chairman. I actually have a question for you, and I just want to make sure that I'm in the right place. This is the Budget Committee, correct? It's not the Irony Committee?
This is the Budget Committee, correct?
That's good to know, because it's incredible to me, the irony that my colleagues across the aisle are trying to paint this as a problem that we caused. My 2-year-old, when she breaks something, she doesn't come to me and say, Daddy, why did you break this? Fix it. She comes up and says, I broke this, we have to fix it. They broke this, and we now have to fix it. So, Mr. White, I have some questions for you. Who was the president that signed the Affordable Care Act? Was it Donald Trump?
It was President Obama.
Interesting. Who was in power that drafted that legislation? Was it Republicans?
It was Democrats.
Interesting. The expiration date of the COVID-era tax credits that were put into law to expire when they did, was that done by Republicans or Democrats?
Twice by Democrats.
Who was the president that signed those? Was it Donald Trump?
It was not. It was Barack Obama. Or
How about that?
Joe Biden.
Yeah, how about that? Do you believe that something that requires so many subsidies to function actually works?
Absolutely not.
So over the past 10 years, we've heard this stat a couple times today, but over the past 10 years, healthcare spending on the federal level has doubled from $937 billion to $1.8 trillion. Does that appear to have helped that industry, or does it appear to have helped the folks that I represent in North Carolina?
What we see in the market is the doubling of costs have generally benefited the large players in the system, whether that's a hospital or an insurer, and you can see that very clearly in their stock prices.
When you find out that your insurance premium has increased, does Congress set those rates or do the insurance companies set those rates?
The insurance companies do.
Interesting. And when hospitals and insurance companies negotiate the rates that they pay each other, does that process involve Congress in any way?
It does not.
How about that? I'm not here to paint anyone as the victim, whether it be private equity, whether it be the healthcare industry, because they're just operating under the rules that my colleagues across the aisle put on them. I would call them handcuffs, not even rules, because they now have to try to make money somehow. And they have appeared to have found that the only way to do that is through vertical and horizontal consolidation. But when you are a private equity firm that owns physician groups, because we've seen that continue to increase, does a private equity firm care more about me getting cheap, inexpensive care, or do they care more about a profit?
They care about profits, but also delivering those services efficiently to
Sure.
lower costs and make better margin.
Yeah, and so what I hear today is my colleagues across the aisle trying to paint us as the people that wrote and then our president signed the Affordable Care Act. We have learned today that that is not actually true. We have been told that all of the problems with rising healthcare costs are at the feet of Republicans. And I cannot tell you just how simply untrue that is. And it's really interesting to me that my colleagues, they continue to speak in hyperbole and just, spew irony to try to make this a problem that was caused by Republicans, because it's not. It is not. Everyone, our insurance costs went up. Going to the doctor costs more. And it is all because of what was caused by the Affordable Care Act.
There is a moment in politics when someone steps up and just cuts through everything. No theatrics, no rehearsed outrage, just pure accountability delivered with surgical precision. That moment happened in the House Budget Committee, and if you missed it, you need to see it. Representative Addison McDowell from North Carolina, a freshman congressman in his first term, walked into that room and did something a lot of veteran politicians have been afraid to do for years. He asked the simple questions. The ones everybody dances around. The ones that, when answered honestly, tell you everything you need to know about why your healthcare costs what it does today. He started with the basics. Who signed the Affordable Care Act? Not Trump. Who wrote it? Not Republicans. Who put those subsidy expiration dates in the law? Democrats. Twice. And when he asked his witness whether something that requires that level of financial subsidy to function actually works, the answer was no. Flatly, unambiguously, no. Now here is where it gets interesting, because this is not just a political talking point. This is structural. When you double federal healthcare spending from roughly $937 billion to $1.8 trillion over 10 years, and the people who needed relief the most are still struggling, you have to ask yourself where all that money actually went. The witness answered that too. Large hospital systems. Large insurers. Look at their stock performance over that same period, and the answer becomes very clear. McDowell made another sharp observation that does not get enough attention. Congress does not set your insurance premiums. Insurance companies do. Congress does not negotiate the rates between hospitals and insurers. Those two entities do that entirely on their own. So, when your premium goes up every January, the people you are pointing fingers at in Washington had nothing to do with that specific number on your bill. That is a private sector transaction operating inside a government-designed framework, and that framework has some serious structural problems baked right into it. He used a phrase that stuck. He called the current rules not rules at all, but handcuffs. And when you handcuff an industry and then ask it to somehow be profitable, it will find a way. Vertical consolidation, horizontal consolidation, private equity buying up physician groups. These are not accidents. These are rational responses to an irrational system. The question you should be asking is, who designed that system, and who has been defending it without fixing it for over a decade? Now, there was also a moment earlier in that hearing worth addressing. A congressman admitted on the record that he is not currently carrying traditional health insurance because he uses an alternative called crowd health, a cost-sharing model, and that it is significantly less expensive than what he would find on the ACA exchanges. Whether you agree with his choices or not, the underlying point he was making is legitimate. The ACA marketplace, for many Americans who do not qualify for subsidies and do not have employer coverage, is genuinely unaffordable. That is not a partisan talking point. That is a lived reality for millions of working Americans who earn too much to get help and not enough to comfortably pay full freight. The deeper issue here is transparency. If hospitals were required to publish clear, itemized pricing, if you could actually shop for a procedure the way you shop for anything else, competition would do what competition always does. It would drive costs down and quality up. That is not a radical idea. That is how every other functional market works. The reason healthcare does not work that way is because transparency has never been in the financial interest of the largest players in the system, and those players have had very friendly relationships with the people writing the legislation for a very long time. What Maddow demonstrated is that the next generation of conservative leadership understands this, not just ideologically but mechanically. He knows how the machine works, where the gears grind, and who benefits when they do. That kind of policy fluency is exactly what this debate has been missing. North Carolina, with its deep medical infrastructure and research tradition, has a way of producing people who understand healthcare not as an abstract moral argument, but as an actual operational system. The contrast in that hearing room was not lost on anyone paying attention. On one side, an argument built almost entirely on emotional framing and rhetorical volume. On the other, a calm and methodical walkthrough of who made which decision, when, and what the measurable consequences were. You can disagree with the conclusions if you want, but the questions themselves were completely fair, and the answers were devastating. Here is the bottom line. Healthcare in America is expensive because the system was designed in a way that rewards size, punishes transparency, and insulates the largest players from real competition. Fixing it requires being honest about who built that design and who has protected it. That honesty is uncomfortable for a lot of people in Washington on both ends of the aisle, which is exactly why a freshman from North Carolina standing up and saying the quiet part out loud is such a remarkable thing to watch. If this country is going to have a serious conversation about healthcare, it starts with accountability. It starts with straight answers to straight questions. And apparently, it starts in North Carolina. Before you go, if this kind of honest breakdown of what is actually happening in Washington is what you are looking for, hit that like button right now and subscribe so you do not miss a single video. We are just getting started.